Can you see my slides?
The slide is visible. Now it is in full screen mode.
Yeah, okay, great. Hello, everyone. My name is Haniya. I am a PhD student at Anglia Ruskin University, and I also teach across public health and healthcare management courses. My topic is about women on the front line of climate change, where I will explore the intersection of climate change, mental health, mental well-being among women living in deprived coastal areas of Bangladesh. It's my PhD thesis, and I will be sharing some of the results from the research with everyone here. Again, I would like to just start my presentation by saying that I am from a public health background, and obviously the thing with climate change is it's very difficult to relate climate change to mental health outcomes. So when we say mental well-being in this research, we mean subclinical outcomes of mental health issues or risks that would eventually lead to mental health issues, which will be diagnosed by obviously psychiatrists, psychologists, and things. But this is just highlighting how women are affected in these areas. And I will talk through why women, why this age group, and why Bangladesh. So let me start. So let's talk about Bangladesh, as most of you would be familiar. It's a small area with about 166 million population and is the eighth most populated country in the world, which makes it very densely populated. And if you have been following the news over the years, there are a lot of refugees that have settled in these areas as well. So overcrowding is a serious issue in this area. Now, the coastal area of Bangladesh has about 34% of the country's total land area and is surrounded by various water bodies on each side. And it houses about 28% of the country's total population, which accounts for approximately 6.8 million households. So, this is the vulnerable population. This is the number of people that are prone to be affected by climate change. Bangladesh is extremely vulnerable to climate-related disasters and is ranked as the fifth most at-risk disaster-prone country in the world, with a vulnerability risk value of 60.48. Now, Bangladesh being a small country, developing country with an overpopulation issue, and most of the people living along the coastline, it is estimated that by 2050, two-thirds of Bangladesh will be underwater if the same trend of climate change keeps happening. And because of its location, it is prone to various natural and man-made disasters, which includes the sea level rise, the cyclones, floods, drought, unsanitary drinking water, increased salinity, riverbank erosion, and landslides. Now, there is always an argument that natural disasters have always been there. So why are we talking about climate change? It's because, as I will tell you later on during my research, the things that I talk to about people, in terms of climate change, we're not saying that there weren't natural disasters before. What we are saying that the frequency and the severity of natural disasters has increased. The weather patterns have become more unpredictable and erratic. So when there should normally be a rainy season, it's not necessarily going to follow the same pattern. And it affects various different industries. It affects various different things in that spectrum. So climate change, as we say it here in this context, is particularly shown by increased frequency of natural disasters and increased severity of natural disasters and unpredictable weather patterns. Now, if we talk in terms of women and children, they comprise about 75% of total displaced people affected by disasters. And in Bangladesh, climate crisis has put women especially in a vulnerable position. Women of all ages are found to be more vulnerable to climate-related disasters, and it is because of various different factors. climate change being one of them, and how it is interrelated to others. We'll talk that through as well. There is a statistic that shows the disproportion of the effect of climate change based on gender. And women and children are 14 times more vulnerable to disaster and post-disaster fatalities than men. And briefly, Bangladesh was one of the few countries where men lived longer than women, which is a little bit different from what a global statistics is. Why that is could be because of, again, various factors where women live in a society which would not allow them to have equal access to resources, to information, and to income opportunities. So all of these factors collectively put them in a very vulnerable position. Now, the consequences for women are especially severe, because if there is widowhood, it poses a serious threat of poverty, insecurity, and socioeconomic crisis. When we look at literature, if we talk in terms of just women, women live in a society that is more patriarchal in nature. And because of this, they would not have equal opportunities. They would not have access to healthcare. Say, for example, if they are not traveling with a guardian, they might not be able to travel long distances. And this is where infrastructure comes into place as well, because there are not enough primary healthcare centers for these rural areas or for these coastal areas. And even if they are not well equipped, or they do not have enough doctors or healthcare staff to look after these women. And with the restrictions imposed by a patriarchal society and religious norm, the income generating opportunities of women are very limited. So they are all more or less dependent on someone else for their income and for their living. And women in these areas are especially expected to take more traditional roles, which would be taking care of the family, taking care of the children, taking care of any sick people or elderly people in the household, to an extent where if there is a climate event or if there is a natural disaster, women are expected to get the children out, to get the elderly people out of the house, to a safe place, whichever has been designated. And after that, they are expected to put themselves. So these traditional gender roles put additional emotional, physical burden on these women. And obviously, disaster affected women are also prone to sexual and reproductive health problems, along with sexual and domestic violence. So this is what I mean when I say that women are in a more vulnerable position. Women are in a more difficult position when it comes to climate change. And we haven't even gone to the physiological vulnerability yet, where women in their reproductive age have to face various issues like access to antenatal, postnatal care, access to mental health services, which are basically none, access to maternal or neonatal health services. None of that is available, especially now. How does climate change come into the picture here? Is, say, for example, if you're living in an area that is only connected by a small bridge, a low-lying bridge, and that is your only way through to the other part of the town where you want to go to. Now, because of the sea level rise and frequent flooding, that area is cut off. So you're not able to get out of the area that you're in. So if you're a woman, say, for example, a woman is pregnant and she needs emergency access to healthcare or any medical care unit, she's not going to be able to go to that part of the town because there is no infrastructure to help them against these natural disasters, which are so frequent now. And if you can see, I've pulled some quotes out of an NGO that interviewed some women. And there are people who have different issues. For example, the first one is that they don't have a house because the houses they live in are temporary houses made of mud, so that they get washed away. And other people would say that few years ago, 10 years ago, 5 years ago, we did not used to have such erratic weather patterns. So we were able to maintain a living by agriculture or farming or having cattle. But they can't do that anymore because there is always a risk of a climate event just ruining everything for them. And again, there is poverty, there is instability. And if you can see the last quote over there, it says, we have cyclones devastating us in one day. Cyclone is tearing us apart, living in these conditions. It makes us worried about our children. Our sleepless nights pass with worries, which you can see how it would lead to negative mental health outcomes. Now, before we discuss the methodology, I just want to reiterate here that women, when they were asked, when this survey was done, it was never said, do you have anxiety or do you have depression? Because that somehow resulted in women getting offended by it or just did not want to answer that. But if you put it in a different context where you would say, do you feel fearful for your children or do you feel anxious? Do you keep reliving that natural disaster event or the climate change event that maybe washed away your house or injured your family member or something like that? That would make them answer the question more. So you need to be more symptomatic rather than just using the terms that you all know, like the symptoms of maybe anxiety or depression or PTSD even. So the methodology used, it's a cross-sectional study design. The survey was conducted in Dekop subdistrict of Khulna, which is a remote coastal area. Target population was women aged 18 to 49 years, so mostly in their reproductive years. Sampling was done through stratified sampling methods. The sample size was 378, which was calculated by a formula, if you can see over here, it's described. So yeah, that was the methodology. Now, to develop the survey instrument, which was a bigger thing here, because again, climate anxiety is a bit difficult to quantify or just to associate. So there were some validated scales which were specifically designed to measure climate anxiety. So I included climate anxiety scale. Then I also included mental health assessment in refugee settings, which was done for women's mental health needs. There was an impact scale and again, Searle and Go's scale to assess emotions which were related to climate change. So these scales were used because obviously they were validated and they, well, some of them were specially designed for cross-cultural assessment, some of them were designed for women, and the climate anxiety scales were specially designed to assess emotions related to climate change, so as to we can develop a more validated questionnaire which would assess their negative mental health outcomes in this group. So the results that I'm sharing are from my fieldwork. So if you can see, most of the people that were interviewed had lived in this area for years, so like 10 to 15 years. And some of them, well, most of them, say 90% of the people lived in this area for more than 5 years. So when we say, has the weather pattern changed over the years, they were in a position to answer it because they have seen it change, as most of us would. I mean, if any of you are living in the UK, we are starting to have 38, 39 degree temperatures, which we didn't have before. But for them, it's a little more than just a nice warm day. So as you can see, people have been experiencing cyclones a lot. Flooding is frequent, river erosion is ruining the fields, so they cannot farm or do agricultural practices. There is drought, there's erratic rainfall. So most of these people have experienced climate-related events. Then if you see participants according to their source of income, especially in women, 77% of the women were housewives. So if you're a housewife, the best you can do is you can either help with agriculture and farming, practices, or you can do a little bit of tailoring. Very few were in employment. And by employment, I mean they would go out and do day labor jobs. The students very less, farming practices very frequent and very prevalent, because they would always have like a little piece of land where they would grow something. Now, if you know a bit about Bangladesh, they do cultivate rice, which is very specific to their weather patterns, and it grows well in those areas. Now, the farming of rice has become difficult because of, again, either erratic rainfalls, or too much rain, or too less rain, or just flooding of the area. Again, taking away their income sources. Now, basic thing, drinking water. We are in 2024 now. There are lots of sustainable development goals, lots of things that people want to achieve. But these women have to still walk very large distances to get clean water. Now, we know there are a lot of WHO interventions like WASH interventions and things which would provide clean drinking water. But if you go and see on ground, there are not a lot of resources for them. There is basically, if there is a WASH water treatment plant, it hasn't been maintained for years. It's just there. And I don't even think it has clean water anymore. And during disaster times, or during these climate events, they have to buy water, which they have to pay for. And if you're already a poor person, it's very difficult for you to buy that water. And women have to, again, like I said, they have to walk distances to get this clean water for their families, because they are the one responsible for it, even if they have to walk miles and miles for it. Now, I've taken some pictures of water supplies, like where the water is kept and what kind of water that they are drinking. If you can see on this picture over here, this is supposed to be a water reservoir, which hasn't been maintained in years. So you can imagine what kind of water supply they have. So when you have this added responsibility of even getting the basic things for your family as a woman, it just adds to your negative mental health outcomes. Now, again, as a woman in that area, you are expected to stay away from a social setting, because you're supposed to be sort of isolated from other men in that matter. These are primary schools that are converted to cyclone centers. Now, what is the problem with these cyclone centers is, first, they are not available in every village. And secondly, females lack toilet and sanitation facilities. So if they need a separate toilet, they don't get that. And again, very vulnerable to sexual violence, abuse, harassment, and that sort of thing. And again, when you go into these cyclone shelters, they're very overcrowded. And the women I talked to, they said that they would rather stay home than go to these places, because it makes them fearful, it makes them anxious, and they're always worried about going to those places, which adds to obviously already bad things. Overcrowded adds to female vulnerability. Then preliminary results for mental health and well-being. As you can see, a lot of women said 88.3% were concerned about well-being due to climate crisis. 57.7% of the women reported suffering from symptoms such as they were feeling anxious or nervous, they have trouble sleeping, because one of the women said while they were sleeping, they would get up at night a lot because they could hear the cyclone warning when it was not actually there. So they always had interrupted sleeping patterns. They were sad and they felt hopeless because they felt they don't know. There was unpredictability related to nature now, which they cannot get over, and they keep thinking about it. And the last time something happened, they keep reminiscing about it and ruminating about it, and again feel anxious and worried. And also would not let their children out because they fear about their well-being. So they're constantly thinking about the family, they're constantly worried about income, they're constantly worried about where they're going to get water and food for their household. And on top of that, the added physiological issues that they face. 81.2% of women reiterated that women face more difficulties due to climate crisis because of the additional needs. And 66.6% of women reported having physical symptoms because of mental health issues following a natural disaster, which resulted in impaired daily function. So it's not just something that they are thinking and it's not affecting their daily life. It is because they have trouble making decisions, they have trouble concentrating, they can't sleep, they are always tired, they have loss of appetite. And as you are more familiar with symptoms of anxiety and depression, they could be risk factors for developing a serious mental health issue. A significant percentage of women also reported having no or limited support from the government and non-governmental organization in this region. Again, it's not just that there are no resources, which is a reality that there are no resources. But again, because they don't have access to it, because they are expected to stay home and take care of everyone else, it just gets lost. The chi-square tests proved significant association with a p-value of less than 0.05 between age of respondents, where the age group of 24 to 35 experienced higher symptoms of mental health issues. Marital status, where married women were expected to have more mental health, negative mental health outcomes. And again, total pregnancies, because the last time they had a pregnancy, it was very difficult for them to get care if a natural disaster had happened or was going to happen. So they were worried about what would happen if they get pregnant again, or worried about their children. Logistic regression showed that women in the age group of 24 to 35 are twice as likely to have negative mental health outcomes. Women with 3 to 4 children are 5 times at risk of developing mental health issues. Married women seem to have higher odds of developing mental health issues compared to single women. Just to give a little bit more context here, there is another part of this research, because this is originally a mixed method research, but this is just the quantitative results. When the qualitative results were done, qualitative research was done with focus groups, members of the community were included, and there is a counselor who's supposed to be the district counselor, who does visit. And when I asked him, I was like, did you get any women who came up to you with mental health issues or issues where they said that they have PTSD, or they have symptoms of anxiety or depression? What did you do? And he said to me that women did come, but they had family issues. So it was an internal issue where they're having problems with their partner, which was possibly causing abuse. But he told them to have some courage and get over it and deal with it, because it was their internal matter. So you don't have mental health centers, you don't have people where you can specifically signpost them to here, this is where you would get your mental health support if you needed to. There is none of that. And even if they have their normal medical centers where they would go and say, oh, I have extreme anxiety, I have these palpitations, I can't sleep, I can't properly breathe, I'm having panic attacks or something, but there is nowhere to signpost them, because there isn't even basic mental health support available to these women. So that is what I have covered mostly in my results. And the conclusion here is that it explores mental health outcomes in context of climate anxiety among women. It intends to provide evidence to support tailored interventions and adaptation strategies. And it's meant to serve as a foundation for further much needed research, because this is a cross-sectional study. And with climate studies, you need to have a sort of long duration of study. So that would be very good. And finally, the results of this study intend to serve as a call for action towards global climate change, mental health, gender disparities among deprived communities who are battling with climate change much more than at least we are. So that was my presentation. Thank you.
Thank you, Dr. Haniya, for a very nice presentation of your work. If there is a good methodology, and I think you must have done into different blocks or whatever is called sampling of, of the respondents.
Yeah. Oh, okay. So this is a sub-district, and in that sub-district, there are different villages. So it was stratified sampling. So there was the villages or the households, and in that, then they were randomly selected, the households.
How many villages were selected, and how many women were selected from each village?
So the villages were eight that were selected, and the total respondents that we had were 375. There was a margin of 10% to cover non-response or missed responses as well.
Thank you. Thank you for giving a very good insight about the mental health issues during climate change in Bangladesh. The house is now open for discussion.
Yeah, I just want to ask one more question, Hania.
Sure.
It's a very nice presentation. I just want to know that climate change is significantly associated with migration. Because of climate change, a lot of people they migrate. Mostly migration happens from the rural areas to urban areas. So that is also having an impact on the mental health. Have you measured those components in your study? And second thing is, my second question is, there are people who are already having pre-existing mental health issues. When climate change happens, the impact on patients who are already having mental health issues, particularly the women, it is likely to further increase. So whether you have explored these areas in your study?
Yes. Okay. Both the points. First of all, with migration, that's another thing that is a problem. Because if you're a woman with a household and you have to take care of, say, 5 people in your household, what happens is if you lose income or if you lose your house or something, more more often than not, the man who's the sort of earner of the family would move inland, and women are left behind to take care of the family. So it's very common for a man to move inland than a woman to move, unless it's just her and her partner, and then they can move, which can happen. But in most cases, because they had a big family and they had these farm animals or a little bit of land, they don't want to leave that area. So women were mostly stay behind, which obviously increases problems as well, because once the partner goes to earn money, he's working these day jobs, they don't pay that much. So then he sends this money home, and women are expected to make do with that amount of money, whatever amount of money that is, which again adds to their mental health issues, because then they are under pressure to feed their family. So the people I talked to mostly just stayed there. A lot of people were not migrating, but their partners had migrated inland. And the second thing was, sorry, I forgot.
Pre-existing mental health
Yes,
issues.
yes. So with the questionnaire, there is a section that asks them. So, for example, if the question was, "Do you have trouble sleeping?" There was a question where it was pre-climate change event and post-climate change event. So we would say, okay, the last climate change event that you remember, did you feel the same before, and has it changed afterwards? And there is a part of the questionnaire that asks that as well. But it was they said the first time that they experienced it was not that bad, but then when it happened twice, 2 or 3 times, then this started to exacerbate.
Can I ask a question? So, there's this disaster and the previous talk. So, is it a solution to prevent all these disasters? Is preventing poverty and improving education, so more or less social intervention, the answer, or is it resilience or is it the provision of mental health services? So, where would you see the priorities?
Oh, I think it can't work in one discipline. I don't think if we are if the goal is to reduce mental health issues, I don't think we can eradicate them at the moment because they are very prevalent. But if the goal is to reduce the mental health issues, then it has to work collectively. Like women should be given opportunities where they can earn a living and they're not stuck to that one piece of land. They can go out and earn a living if they need to. And secondly, they need to have access to resources and information. And thirdly, government has to build infrastructure as well, because if there are some areas that get completely cut off during flooding, there has to be a way for them to get out. If there is no way to get out, what are you supposed to do? And again, if you have primary health centers, they need to be equipped with doctors and mental health providers, service providers, in case of a, say, emergency case, if something shows up. But there is nothing. There are traditional healers, there are quacks who mostly do medical treatments. So even again, mental health centers for women, very important, that need to be built, or at least have some resource, because the information they have about climate change comes from NGOs. It doesn't even come from like a government organization. There are some NGOs who would go and talk to women, and there are some midwives who would go and talk to women about the issues that they're facing. And I think domestic abuse is a huge problem there right now. I couldn't ask that question directly because then I had to go through a different set of ethics. But there is a prevalence of that as well. So it has to be a collective effort. It can't be just one department doing something.
Thank you.